Medical examiners, what is the weirdest anomaly you've ever found on/in a body? Story 1. I'm a physician assistant specializing in pathology. One of my favorites was actually the first case I saw rotating at a medical examiner office during grad school. This guy got depressed over whatever and decided to fill a backpack with bricks and jump off a bridge. He did this in the late fall and, obviously, sank to the bottom. What he did not account for was that, over time, his body would continue to fill with gas due to the bacteria slowly eating away at his insides, to the point that, even with a backpack full of bricks, he would still float to the top. He finally resurfaced in early June. The guy was unrecognizable, essentially looked like a bloated blue frog. Smelled awful. I've got a ton of stories, but I'm at work now. Maybe I'll post more later if anyone is interested enough, and this post doesn't get buried. Edit. Due to some interest, here are a few more stories I can think of, one per paragraph from here on. During a heat wave, a body was found that was a few months gone. Just about all the internal organs were liquefied, and the heart was all brown and mushy. While I was dissecting the coronary arteries, innumerable maggots started emerging from the arteries and out of the heart. I was moderately disgusted, but the attending got all excited and said, "No, this is great evidence." Apparently, maggots cannot eat up the arterial plaques or clots that would have caused a heart attack, so we were able to eliminate that from the differential. I don't think the cause of death was ever fully determined, but I learned something that day. An 8-year-old kid was found at a train yard with burns all over him. Apparently, he snuck away from a block party to go climb and play on the trains, and his friend dared him to touch the cables indicated with a large, high-voltage do not touch sign. He was found several yards from the train, and it appeared he had been thrown that length, not dragged or moved. So when you see someone get electrocuted in a movie, the force of it really can throw a person quite a distance, so that's not just Hollywood nonsense. As follow-up, the kid had a history of sneaking into that train yard and playing, and had been caught/removed several times and warned not to come back. The parents still went on the news a few days later and blamed the railway, ended up suing, and won for a lot of money. We had an elderly man who passed under unclear circumstances, except his throat had swollen shut. What we learned was this man had previously had a stroke that affected his sensation to pain. One day he decided to make a baked potato and ate it far sooner than he should have. The potato was so hot it caused severe burns to his mouth and throat, with the ensuing edema swelling his throat shut and causing him to suffocate. The resident I worked with on that case dubbed it death by hot potato. It's not uncommon to have people get shot in the heart, but found dead a block or so away with scrapes all over them. Unlike Hollywood, getting shot in the heart doesn't kill you instantly. As one can suspect, most people don't like getting shot at, and instinctively try to run away. Essentially, these people die in mid-stride when they finally bleed out and collapse wherever they end up. Not a cause of death, but probably my best story at parties. I used to work at a university medical center, and we would get research requests fairly often. One day, an ear-nose-throat surgery resident showed up in the morgue and needed help getting at the temporal bones in 6 frozen decapitated human heads. If you ever donate your body to science, things like this can happen. To do this, we had to pull the brains out, think frozen jello, and then feed the heads to a bandsaw straight down the middle of the face, through the nose and out the other end. Unfortunately, our bandsaw was on the fritz and shorted out in the middle of head number 3. Some poor maintenance guy had to come down and fix the thing with this dude's half-dissected face staring at him. Good times. Edit 2. More stories. Upon further request. As a warning, these are a bit more depressing. Not mine, but a colleague's story. A body was brought in from a house fire. The man escaped unharmed, but returned to the home to try and save his dog. When his body came to the morgue, it was severely burned. They proceeded with the autopsy to confirm there was no foul play, and discovered that the dog was found with the man, tucked up under the man's arm. He had died cradling the dog in an attempt to protect it from the fire. Another colleague's story. A homeless man was brought in after being found dead in a ditch. He had no ID. No one knew who he was. During the autopsy, they found a small tattoo on his arm that said, "I love you, Dad," with a child's name underneath. They were able to track down the family using that information. Turns out the man had been missing for years, and his family had no idea what happened to him. One more from me. We had a young woman come in who had died from an accidental medication reaction. During the autopsy, we found she was pregnant, about 8 weeks along. The family didn't know. It was heartbreaking to have to tell them. Story 2. Combining the facts and my own assumptions, I would say it was a rapidly progressing colorectal cancer of some kind, possibly related to underlying Lynch syndrome, that metastasized to the liver, the lymph nodes, the peritoneum, etc. This was a forensic, as opposed to clinical, autopsy. So some of the techniques that could have been used to construct a more precise narrative of what had occurred in regards to his cancer, which was not the cause of his death, was beyond the scope of that procedure, but durable tissue samples were taken to make pursuing that option available to the family. I really don't have an explanation for it. There are rare causes of reduced pain sensitivity, many of which wouldn't be a possible explanation in this instance, but some of which might. Toxicology was positive for certain prescription pain medications, but in such a way that suggested a more isolated exposure as opposed to chronic use, but there are limits on what can be known for sure there. It's possible that a sedentary lifestyle combined with adherence to the kind of low-protein, low-sodium, no-alcohol diet that a doctor might recommend to someone with, say, liver failure, combined with occasional use of these medications, did somehow in conjunction mask his symptoms. It's also possible that he was doing something, I don't know what, just something, which he believed to be damaging enough to the body that he felt it explained his symptoms, and for whatever reason didn't consider the pain, the vomiting, the fatigue, the blood in his stool, or whatever else, undesirable or cause for concern. Maybe he had tried unauthorized substances or what have you, and had been under the mistaken impression that that exposure was somehow sufficient to explain subsequent problems, and he was too embarrassed or afraid to tell anyone. It's also possible that somehow he knew what his situation was, and there is just no record of it, and he didn't pursue treatment or tell anyone, or drop out of school, or do anything that would give any indication that he was in possession of that knowledge. With each explanation I can think of, there are valid criticisms of said explanation, and so nothing has ever felt like a perfect fit in this instance. Story 3. I may be late to the party, but I finally have a good story to tell. In medical school, my group's cadaver was an over 80 years old female who was extremely unfit, morbidly obese with muscles half the size of any other cadavers. Her pectoral muscles were paper thin, to get some reference. We figured she was bedridden during her last few months, which would somewhat explain these findings. When we started our neurology unit and began to dissect the infratemporal fossa, I discovered a small metal pellet under the skin behind her right ear. My tank mates and I went on to find dozens of these metal pellets strewn around her head's anatomy, with some lodged into the cranium and others in the bones of her face. We contacted her living relatives to get some clarification, and they ended up revealing that when this lady and her brother were children, they said she was 8 years old, they were playing with an old decorative rifle that the family had mounted above the fireplace. Long story short, the brother accidentally discharged the rifle into the girl's face. The aftermath was, this lady was blind and wheelchair-bound for the rest of her life, and the pellets weren't all removed. It was an interesting dissection with that information from then on, but a sobering moment in reminding our class that our cadavers are humans with their own struggles and rich lives. If you're considering donating your body to science, please know that we don't take the responsibility lightly, and a million thanks aren't enough. I have more stories if anyone is curious. Edit. I should add that her granddaughter made a point of saying this lady did not hold a grudge on her brother, and they lived full lives on happy terms. Story 4. Masters in Forensic Pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed, and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy, the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the emergency room and had chest pain, then died shortly after. Dies of a heart attack, but also had cancer. In less natural circumstances, though, saw a guy who had been shot in the head a couple of times. 3 definite entries and a severe head injury, but police only found 1 bullet. Couldn't find the other bullet in his head at all, assumed the police missed it, went on as normal with the autopsy until we got to the chest cavity. The other bullet was just beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck and into the chest. That was pretty wild. Story 5. Not mine, but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night to avoid too many people during the day. One time it was really late, around 2 a.m. He was listening to his lecture on his headphones, and he saw the cadaver's arm move/twitch. He thought it was just his mind playing tricks on him. Then he saw it again and proceeded to run away in a panic. He told a few of his classmates what happened, but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging, and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved. He thought there was a zombie in there. Story 6. I used to work in the emergency room, and one time we had a young woman come in, maybe 22, who was morbidly obese. She kept gesturing vaguely at her lower abdomen, saying, "I can't see what it is, but something hurts." In the course of the exam, we had to lift the flap of fat/skin that hangs down. As it was lifted, we found an abscess with a weird orange substance all around it. Long story short, she had dropped a Cheeto while eating, and it had gotten stuck in her rolls. It stayed so long that it eroded a hole in her skin. My sister still hasn't forgiven me for telling that story at dinner one night. Story 7. I'm going to use my throwaway for this. So going with the gist of the topic, I work as a registered nurse in labor and delivery at a high-risk center, so we often get the worst cases. Unfortunately, fetal demises aren't too rare, usually from congenital abnormalities or spontaneous abortions. Having worked in the past with adults who have died, working with deceased babies is much more disturbing than I would have ever thought. Anyways, 2 stories stick out in my mind the most. My first fetal demise was an induction for an 18-week-old fetus. I don't remember the cause. Fresh out of school and loving working with happy, healthy babies, this assignment terrified me. The mother delivered the baby completely intact in the amniotic sac. With the mother and father sobbing, I went to pick up the sac, place it on a blanket, and take it over to the table to examine and assign APGARS, obviously 0/0. I stood there staring at this very small and underdeveloped baby, trying to remain professional and maintain my composure, but was completely frozen with fear. My preceptor at the time said, "If you're okay, go ahead and open the bag. Take the baby out, wrap him/her up, and hand it over to mom." Fluids were present, and it was a very intense experience. Holding my breath, I took out the baby. At 18 weeks, the skin was very red/pink and sticky. We couldn't tell if it was a boy or a girl. I think I was more terrified to show the parents, who had already been through so much, because I knew they imagined their beautiful baby to look very different than from what I was about to hand them. I cleaned up, gave the family some alone time, and stepped out of that room completely changed. My next story happened when I felt a little more comfortable in these situations, as much as possible, I guess. This baby was around 18 to 19 weeks. Induction, due to anencephaly. The baby had been delivered by the time my shift started, so it was now my job to take photos of the baby, footprints, and clean it up for the family. Anencephaly means the baby has no brain, basically the top of the head is missing. This was disturbing but manageable. What made it worse was that the baby showed minimal signs of life briefly. We wrapped the baby and gave it to the parents for their time. Sad tone overall. Story 8. Current pathology fellow, board certified, not in forensics though. Participated in around 80 autopsies. Weirdest/scariest case. A body was recovered from a house fire. The body was severely burned and rigid, with limbs curled up against the torso. We x-rayed the chest, abdomen, and head to see if there is anything of interest before dissection. Metal fragments in the chest. Do the autopsy. The internal organs are largely intact, despite the significant heat damage to the skin and soft tissue. This is not unexpected, I learn. There was a large hematoma, over a liter, in the chest. There is about a 2-centimeter jagged opening in the heart. Metal fragments embedded in the left lung. Tracing backwards from the heart, a path is found through the posterior thorax, with a possible entrance wound in the upper back. He had been shot. Detectives arrived to morgue. Say they've got the homeowner/roommate in custody. They're interrogating him right now. He owns a gun. He's been having frequent noisy arguments with the dead guy/tenant that have been observed by neighbors and reported to the police. He was away from home when the fire was happening, claims no knowledge of any of this, has no idea what happened to either his house or the dead guy. Detectives high-five each other when we tell them he's been shot and it's definitely homicide. We find out later, after they fully interrogate the homeowner, he confesses to shooting the roommate in the back while he is sleeping and then torching his own house to try to hide the evidence. The roommate was actually his tenant and he wouldn't move out, so he killed him. Scary stuff. Story 9. Oh, my time to shine. I did a forensic pathology rotation in medical school in Florida. Was working there one day when they brought an old guy in who had been found in his apartment in the middle of the summer with no air conditioning after about a week, so he had decomposed pretty quickly. When bodies decompose, the bacteria inside you eats the tissue and releases gas, so bodies tend to be bloated. So when they unzipped the body bag, I wasn't surprised to see that. But I was surprised to see that his scrotum had become extremely swollen, about the size of a football. This apparently occurred via the same bacteria process. Anyways, I was being keen, and I think they liked me, so they used a large needle to release the gas. As the gas escaped, they ignited it to demonstrate its flammability, which helped reduce the odor in the lab. The flame lasted for about 20 seconds. They justified the process by saying it decreases the smell in the lab. Talk about seeing things that very few other humans have. The scrotum blowtorch. Story 10. Not me, but my boyfriend's mom is a doctor for people with special needs. One of her patients, an older man with Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly, one afternoon, my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty. That this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days, he passed about 20 of these in total, and he felt better and better, and luckily started eating again. Most likely he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing/seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like little poop balloons in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff, like this one time he ate a t-shirt. Edit. Too long. Didn't read. Man experiences abdominal pains, unable to defecate, and stops eating. After nearly 2 weeks of this, he starts passing blue latex gloves filled with poop and feels fine again. Story 11. I have a few thousand hours of cadaver dissection under my belt, and anatomical abnormalities are my absolute favorite to stumble upon during the course of a dissection. We all have a general plan with our bodies that most of us follow, but there are variations that will never have any positive or negative impact that you will never know about, and somebody like me stumbles upon it after the fact. There are a lot of documented variations in texts like Gray's Anatomy, but sometimes you'll stumble upon things that you can't really identify or aren't really too well documented. Some people will have extra muscles in their arms, legs, or hands. I'm not talking about things like plantaris or palmaris longus, but extra muscles that are completely unique, with no documented names that I could find. It's always really odd. Sometimes, people will have congenital abnormalities and be missing a muscle, artery, nerve, etc. One person, their vertebral artery came directly off of the aorta on the right, I believe, going by memory, as opposed to the subclavian, which is the normal occurrence. Now, the really odd part about this was that the left vertebral artery terminated at the posterior inferior cerebellar artery, so the basilar artery contribution was only from the right vertebral artery. Their circle of Willis had an incomplete contribution, but I don't know anything about the people when they are alive, so I don't know if they had any cognitive or neurological deficits. Story 12. I've never performed an autopsy, but my friends, they were 3 siblings growing up, had a pathologist for a father. I was over their house so much that I became a fixture in the family / included in most of their adventures. Me and the oldest son got a hold of some liquor one night and got wasted. My father is an alcoholic, and it gave me a bad home life / probably was a significant factor as to why I basically moved in with them. We were caught. I was nervous and sad, expecting them to deem me a bad influence and abandon me, a cycle I was familiar with. Their parents beckoned me into the dining room, wanting a private talk. I braced for the worst, but instead they sat me down, told me they loved me, and that I had to be careful with alcohol due to addiction having genetic components. We talked a long time, and when it was over they informed me I wasn't off the hook yet. Apparently they had a surprise for me and their son, which would blow my mind. The next morning we were woken and told to get dressed and get in the car with my friend's dad, the pathologist. He drove us to his work, where he showed us a cadaver and the liver of a middle-aged man who died of cirrhosis. It burned in my brain and I never forgot it. It had such an impact on me to see how alcohol destroys the body. While I wish I could say I escaped alcoholism, I would go on to have my own struggles. But they probably would have been a lot worse if it weren't for this experience. Story 13. Guy came in for an outpatient magnetic resonance imaging of his cervical spine. On the form where it asks if he ever had any metal in his body, specifically asks if any injured by a metal object, he selected no. Same with a verbal questionnaire. Also, we do a keyword search in the patient's hard chart for the term foreign body in case it's documented nothing came up. He lays down, and I start taking images while talking to him, though the speaker. During one of the image sets, he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic, so I stop the machine and get him out. Immediately he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down and security as he's flailing. Continues screaming and running into the wall before we restrained him. The staff rush down, and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in, scared out of his mind and hallucinating. Security restrains him, and he's taken down to get an X-ray of his skull. There was a BB pellet in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department, he kept trying to escape, and was very fast. While unrestrained, he got up, somehow convinced the guard he was better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour, nobody could find him, until a nurse looked into a large storage closet. The poor guy was found with severe injuries after crashing into a large mirror that was leaning on the wall, and had severe lacerations of his neck, face, and arms. Efforts to save him were unsuccessful. Still haunts me how a simple BB pellet from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. Story 14. Performing an autopsy on an elderly patient with cardiac valve disease, and found a 3-centimeter white plastic disc lodged in the ostium of one of the renal arteries. It was identical to the disc of the patient's tilting valve type mechanical aortic valve, which was in place, intact, and functioning normally. We had no explanation for why an extra valve disc was present far downstream from the heart. An in-depth review of the patient's surgical history revealed that many years prior, during the installation of the patient's aortic valve, the cage for the valve broke while being installed, and the disc had flown into the aorta and couldn't be retrieved. The surgeon immediately removed the broken cage, replaced the entire apparatus with another replacement valve, and completed the surgery. We found no evidence that there was any subsequent investigation to determine the whereabouts of the lost valve component. So for years, apparently unknown to most of his caretakers and even potentially to the patient had a cardiac valve disc lodged in his renal artery ostium in such a way that it was non-obstructing and stable, and it was discovered as an incidental finding at the patient's autopsy. Story 15. I did an autopsy of a young kid around 10 years old who had hydrocephalus and was quadriplegic, yet retained some of his normal functions, like talking and understanding, albeit minimally. When I opened his skull, I was shocked to find the brain so severely atrophied that it was tiny, smaller than a golf ball, with approximately 1.5 liters of fluid filling the skull. Amazing how he survived until 10. Story 16. I had a calf that died out in the field at about 14 days after a couple hours of respiratory distress that did not respond to antibiotics. We were expecting it to be pneumonia, which is fairly common in calves. He had a double outflow right ventricle and just this little flap of non-functional left ventricle, so the blood entered the right atrium, went to the right ventricle, out to the lungs, and back to the left atrium, where it entered the right ventricle through a common atrioventricular valve. The blood also left the right ventricle through the aorta, so both pulmonary artery and aorta came off the right ventricle. There was significant dilation of the pulmonary artery from pulmonary hypertension, and he developed congestive heart failure. Pretty neat, a bit sad, and very unexpected. Really cool to see a single ventricle heart in a mammal, almost like a lizard, and wild that he made it to 14 days like that. Story 17. I've told this story on Reddit before, maybe on my other account. I worked in medicine as an X-ray tech/medical assistant. One day we had a patient come in complaining of a stomachache. Considering the time of year, it wasn't an abnormal complaint to have come into our family practice. So we ran him through the normal tests, urinalysis and an abdominal X-ray. Kidneys, ureters, bladder for those medically inclined. It was a shorter man, so there was a lot of room on the film. This kind of X-ray is centered on the belly button, mainly used to see how full the intestines are. When I processed the film, we noticed a blockage in the lower intestine. I showed the doctor, and she laughed. Unusual for her, as she was usually serious about these things. She asked me to join her while she questioned the patient. It turned out that the patient had inserted a small medical item internally to manage discomfort, but it had gotten stuck and needed removal. The procedure was performed safely, though it was certainly a memorable experience for me. Story 18. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow, womb lining cells had traveled to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax, collapsed lung. The womb cells had tried to shed, and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with the endometrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. Story 19. A mummified fetus. I was working in Africa, and the usually very stoic Congolese surgeons called me in to theater, gagging. The patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long, dead, mummified fetus, which, as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue, and over the years, it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific, and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a memory. Story 20. I worked with a man who carried a lot of emotional baggage. When he was a teenager, he and his younger brother were roughhousing, and he accidentally pushed his brother against a wall. His brother paused for a moment, saying he didn't feel right, and then collapsed. At the autopsy, the coroner discovered that the younger brother's brainstem had been extremely fragile, essentially, quote, dangling by a thread, and any minor bump could have detached it. That he survived early childhood milestones, like learning to walk, was a miracle. The older brother still felt guilty for what was ultimately a freak accident, which was understandable, given the circumstances. Story 21. Not a regular autopsy performer, but I do a lot with forensic archaeology, mostly natural mummies now, and had to take an anatomy and physiology class that involved cadaver dissection. Female patient died at 102 of natural causes. We found that the joint of her left elbow was replaced with something that legitimately looked like a car part. It turns out she'd lived somewhere in Soviet Eastern Europe and had the procedure done sometime in the 1960s, and it looked like that replacement was done with whatever they had available. It was absolutely incredible. Story 22. Pretty memorable to me. I'm a doctor, was working in operating theater anesthesiology. An emergency came in the afternoon. Apparently the patient is a fisherman and got into a fight with his fisherman friend. Patient was impaled by a spear gun. The spear entered just lateral to his belly button and came out just above his right hip. He actually held this 6-foot-long spear going through his body and walked into the emergency room by himself. When it was time to put him under, he wasn't scared/anxious. He said, "Just fix me up so I can go find that guy." Story 23. One of our cadavers had 2 spinal cords, aka split spinal cord malformation. Edit. Just a first-year med student here, folks. Unfortunately, it's against our school's policy for me to even take photographs, yet alone share them. One of our groups during our laminectomy, removing the back of your vertebra to expose spinal cord lab, once they cut into the dura mater, the tissue that wraps around the spinal cord, noticed a spit cord in the thoracolumbar region, side by side. Our lead anatomist was very excited to see this, and had the whole class come see. Apparently it's not the most incredibly rare thing, but it is the weirdest anomaly I've seen thus far. Edit 2. So a lot of people are mentioning spina bifida. From what I understand in my studies, that would be the result of bones in the spine not forming correctly. This was not what we saw. There were no signs of prior surgery or herniation of the meninges. Story 24. I was a combat medic in the Army. Not super uncommon, about 1 in 10,000 people have it, but I had a buddy with situs inversus. All of his major internal organs were reversed, heart on the right side instead of the left, for example. As soon as he got to the unit, it was the first thing he told me. Wanted to make sure if he got hurt. I wasn't curious as to why he had no heart, I guess. Edit to say, had to look up the name and how uncommon it is, because it's been a few years since I got out, and he's literally the only person I've ever met like that. I was honestly surprised at how common it actually is. I figured it'd be more rare. Story 25. I did an autopsy of a young kid around 10 years old who had hydrocephalus and was, although quadriplegic, yet retained some of his normal functions, like talking and understanding, albeit minimally. When I opened his skull, there was no brain. I was shocked. This was my first time witnessing something like this, but there was approx. 1.5 liters of fluid and just an empty skull. The brain was so severely atrophied, it was tinier than a golf ball. Amazing how he survived till 10. Story 26. I performed autopsies for almost a decade. The most unique thing I saw was uterine didelphys with a septate vagina. Basically, the vagina split in two and went to two separate cervixes and two separate uterine cavities. The two parts of the uterus fused into one heart-shaped body. I only saw that once. We didn't tend to gather that information when it wasn't relevant to the cause and manner of death, so I don't know about her pregnancy history. The fallopian tubes and ovaries were normally formed, though, so I don't see any obvious reason she couldn't have. Story 27. In a previous career, I was a United States Army Criminal Investigation Division agent, and for every death investigation that required an autopsy, we had to send an agent to photograph and observe for the case file. One man, who suffered fatal injuries inflicted by his wife, was in peak physical shape. When the pathologist examined his brain, he said, "Look at this. I have no biology training, but the golf ball-sized tumor on his brainstem was obvious even to me." The doctor said he had maybe 90 days to live at the time of his death. The wife went to prison for a criminal act, and all she had to do was wait a few months, and she'd have been a hero Army widow. Story 28. Not a doctor, but my brother and I were the first for my mom's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother, and a month or so later she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine, so a month before my brother's due date, the doctor finally realized that there were two of us. This was in 1985. Ultrasounds weren't nearly as good as they are today. They had to rush my mom into an emergency C-section because I was in distress. I came out at 4 pounds 7 ounces, and my brother came out at 8 pounds 13 ounces. I spent the first 3 weeks of my life in an incubator, and my brother spent his first 3 weeks at home. My mom said the doctor was super excited and wanted to write about us in some medical journal, but my mom told him no. Story 29. My 4-year-old son at the time went through a stage where he would put things up his nose. Why? I have no clue. The first time I noticed, his breath smelled, so I made him brush his teeth again. His dad was putting him to bed, and noticed not only the smell, but that his nose was runny with green stuff. I brought in some tissue, wiped his nose, and that's when his dad noticed something yellow inside our son's nose. It was a piece of a Nerf ball. The second time it was a Lego, the third time a paper towel. That one was caught really quickly, with more than half of the paper towel hanging out of his nostril while he was walking around like everything was normal. We caught him a couple of other times trying to put objects up his nose, but luckily nothing got as serious as the Nerf ball episode. Took him to the doctor thinking maybe sinus infection, head cold, allergies. Nope, he just liked shoving things up his nose. The pediatrician said maybe it's just something he'll grow out of, and he did. My son is a young man now. For those who asked, I'm not sure about him putting objects in other body parts, and no clue about any substances either. He does random drug tests for work, so I believe he's clean. I thought about checking his nose for old time's sake, though. If you feel unsafe with your thoughts, please seek professional help. This video does not promote illegal activity. Stories are shared for commentary and education.